This review is all about looking at the epidemiology studies that relate to unconventional oil and gas development and human health. Epidemiology is the science that looks at patterns of exposures, if you will, whatever they are. They could be environmental factors, infectious factors, and human health outcomes, usually disease or other adverse outcomes. And the whole point of the science is to try to understand the relationship between these two things and add to the understanding of whether there's a causal relationship between an exposure and an outcome.
Development of oil and gas from what we refer to as unconventional deposits, mainly shales, really took off in the early part, maybe 15 years ago, when we learned how to drill into these formations laterally and fracture them and recover the oil. It's an industrial process, typically referred to in the popular press as fracking. There are chemicals that are injected underground, and there are also waters that are produced from the drilling that have contaminants in them. And so there's a concern that exposure to these contaminants could, in fact, cause health effects.
This is a wonderful committee, and I really enjoyed working on it. They're epidemiologists like myself. There are people who are so-called toxicologists, people who understand the effects of chemicals on people as well as experimental systems. There's exposure experts, people who understand a lot about the fracking process, the chemistry, and how these pollutants that are associated with fracking move through air and water. That was the kind of multidisciplinary committee that allowed us to use the best expertise to judge these studies and what they mean.
We approached the review in a very systematic fashion. Our review process involved a few different phases. The first phase was to conduct a very comprehensive review, or search actually, of the literature to find as many articles as we could in which investigators used an epidemiological study design that would allow them to quantify the link between oil and gas development exposures and health outcomes. And in the second phase of our review, we used a predefined set of criteria to assess the quality of each study in a very in-depth manner. And in the final phase of our review, we combined information across studies to determine whether or not, for example, for a given health outcome such as asthma, whether the information would be sufficient for us to make a determination on whether or not oil and gas development activities were associated with the health outcome. So our search process found 25 studies that were conducted in several of the major oil and gas development regions across the United States, including Colorado, Oklahoma, Ohio, Pennsylvania, and Texas. Overall, the 25 studies assessed a variety of different health outcomes, including birth outcomes, asthma exacerbations, cancer development, and cardiovascular effects. And the studies also overall used a variety of different study designs and methods to assess linkages between oil and gas development and health outcomes. Some studies were of very high quality and also made very innovative use of pretty limited data resources. None of the studies quantified exposures using measurements of chemicals or noise coming from oil and gas development activities.
There were a total of 25 studies that we felt we could evaluate that really was very informative about what the potential relationship might be between exposures and health outcomes. We can see that some of the associations, the linkages that were found, they suggest that, in fact, unconventional oil and gas and development might be associated with particular health outcomes related to pregnancy, cancer, asthma, and some other outcomes. However, The science is just too early. The studies have a whole assortment of limitations. Those studies include many that are not comparable with each other, making it difficult to synthesize the studies into an overall assessment for any particular outcome. We don't have enough information of a truly comparative and synthetic nature that allow us to conclude what unconventional oil and gas development is responsible for in terms of health effects. We definitely need more research and more rigorous research.
As important health research continues, people are living and working near unconventional oil and gas development. There, they can be exposed to a range of activities and chemicals. Even those who see benefits from the development also see headlines about the health studies. So it's entirely understandable that they would want to know whether this development is affecting their health or the health of their families. Likewise, responsible regulators and company officials must rely on a good understanding of how exposures can arise so that they're confident that their protective measures ensure the safety of oil and gas operations. Whether you strongly oppose oil and gas development, strongly favor it, or hold a view somewhere in between, these operations are continuing. This is why HEI's Energy Research Committee will use the findings from this review, along with its parallel review of the exposure literature and consultations with knowledgeable individuals, including regulators, scientists, community members, all toward identifying and delivering quality research as quickly as we can. Our overarching goal is to support decisions that will ensure the protection of human health.